What's going on, everyone? Happy Tuesday to everyone. Hopefully, everyone is doing well, staying safe and healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, August 29th, 2023. Starting off today, we do have a few news stories. Then we will get through some data, which includes finishing the rest of the states we did not look at yesterday on Walgreens. So let's start off here. Starting off on my website, datareport.info. This was posted yesterday, I should say, by one of my members on my site. Fantastic stuff he always posts. And he posted that the main emergency 911 call center for Lexington, Kentucky, has been closed due to a COVID-19 outbreak that has affected 9 employees. The backup emergency call center has been activated, and there's a link here to the full story. I have a whole section where we do talk about COVID outbreaks on my website, and I believe there's another one here I should probably be sharing. Yes, in Vermont. Check this out. In Vermont, Middlebury, this was the Bread Loaf Conference. COVID-19 is spreading during Middlebury Loaf Conference as of Saturday, August 26th, this past weekend. 28 people from this event have tested positive for COVID. So remember, in the early days of the pandemic, Vermont was, faring out better than most states. Well, guess what? Vermont is not immune either, and there is a COVID outbreak in Vermont. It's the first time we've reported on one in Vermont in quite some time, and here's actually the full story right here. If you want to see that, just go to my website, datareport.info. You can read what I put there, and you can also actually click on this full story, which is right here, which goes into greater detail. All right. Hawaii is seeing a COVID outbreak. COVID outbreak prompts restrictions at Hawaii's largest prison. And so far, 58 prisoners have tested positive at this prison. That is a lot of people. This is the Halawa Correctional Facility where this has happened. And again, 58 people. So we'll have to keep an eye on this. We often don't get updates on these various different outbreaks that I share with you from news websites, but maybe we will for this one, because this is a fairly significant outbreak, and it's coming from a big place. All right, who knew these even still existed? But one did. This is in Boulder, Colorado. COVID-19 call center in Boulder County shuts down. BCP, I guess that stands for Boulder County Public Health, says that the reason for the closure was due to federal funding ending on July 31st, and apparently they've had a call center for the last 2 years in relation to COVID. Look at this. During its time, the call center fielded more than 4,000 calls from Boulder County residents regarding such subjects as testing, vaccine questions, and vaccine appointment assistance, among others. So, yes, it's a sign of the times. It is shutting down. Alrighty. BA 2.86 variant tracker. This is from BNO News. Let's go over the cases here. Denmark totals 4. United States of America has 3. South Africa 2. Portugal 2. Germany 1. Spain, Israel, Switzerland, Thailand, United Kingdom all have 1. There are now a total of 17. That is higher than yesterday's number. I guess if there was a silver lining, if there was a bit of good news, it's still only at 17. What has this been, almost 2 weeks now? So, I mean, it's not rapidly going up, but at the same time, our detection around the world, because everyone's much more laid back now, data's not as good as it once was. We're probably missing cases. We know it's been found in some wastewater in various different places, but this number is not rapidly going up, and that's kind of a good thing, but we'll have to watch. That could change at any given time. It's only 3:13 on Tuesday, so it may go up more later in the week. It's expected to. All right, taking a look at this. We showed you this for the first time yesterday. This is the heat-related illness dashboard that the Biden administration has set up. I think it's about time they did this. I mean, I think this is a great idea. Take a look at the color code here. The ones that we really concern about is this orange and this dark brown. Dark brown is much higher than average. Orange, this brown color, is higher than average. And you can see there's still a lot of counties in this country, especially in the South, that are seeing a high number of calls for heat-related illnesses. So this is relatively concerning to see. And remember, it's still summertime, but Labor Day weekend, which is the unofficial end of summer, is coming. It can still be hot in September. So I suspect this is going to continue. Like up here where I'm at in Philadelphia, next Monday I'm predicting it's going to hit 90 degrees here. So there you go. Heat-related illness, it can continue well into September, and we'll keep watching this. And this data update was as of August. I thought I saw it say as of August 28th. Yep, updated on August 28th. Speaking of climate and health, we have to take a look at today's air qualities. And the worst air qualities in the country right now continue to be on the West Coast, where we continue to have problems. But we're seeing a new issue starting to pop up here. Look in the northern plains. Yeah, look at that. You're seeing some more red. So that's unhealthy as well. Again, limit your time outdoors if you're in this area: North Dakota, South Dakota, Nebraska, Iowa, Minneapolis, Chicago, borderline for you. And especially if you're in Northern California, Oregon, Idaho, Washington, even up into Canada. I got to include you guys as well. Alberta, British Columbia. These are really concerning areas, so you do want to limit your time outdoors in those areas. The rest of the country, there is a lot of yellow. It's not terribly concerning, but it's not perfect either. And if you want to learn more about weather and climate, I do have a channel where I talk about just that at Climate Data Report. Lately, our focus has been on Hurricane Idalia. If you want to find out the latest on Hurricane Idalia, check that channel. I just posted an update literally just before recording this video, and we will eventually get back to the regular climate update once Idalia has finished its business with the southeast U.S. All right, now let's get over to Walgreens. Let's refresh this so it comes up. It looks like it is freezing up at the moment, which Walgreens does do that sometimes. Just a couple weekends ago, they completely locked the website. All right, we're going to finish all the states that we did not do yesterday. We may hit a state that we already did. It is what it is. I know we did not do Oklahoma because I went back and checked. Oklahoma this week was 37.5% positivity. The prior week was 41.7%. That's actually down. That's down by 4.2%. Total testing was up as well, 32 versus 12. And we know on the national level, I got to show you this. The national level testing was up 5,238 versus 4,468, and the national positivity did drop. Still very high. I mean, 43.6%. Come on, that's ridiculous. And the prior week was 44.9%. Difference of down 1.3%. My hope here is we can see as we continue through the rest of the year, we can see each week a little bit of an increase in testing. I would love to see this get back to above 10,000 again. Will it happen? I don't know. Probably once this wave peaks, testing will probably fall off some. But, as we see another wave, which will happen in the fall and in the winter, maybe it can go back up again. I don't know. It would be just nice to see more testing to help get that positivity down. All right, Kansas positivity trend. Current week, 16.7%. Prior week, 37.5%. That's down 20.8%. Total test, 12 versus 16. So, yes, this is a legitimate drop. Not dropping is Nebraska. Nebraska is at 46.7%. The prior week was at 28.6%. That is up 18.1%. Total tests, 15 versus 14. This is a legitimate rise. Minnesota, 28.6% this week, 44.9% last week. That's a difference of down 16.3%. Total test, 42 versus 49. So testing dropped and the positivity dropped. We'll take that. Iowa, 43.8% positivity this week for you. And prior week was 16.7%. This is a humongous increase. 27.1% up. Testing's up 16 versus 12. And look at this chart. It is literally going straight up. You're not going in the right direction.
Now taking a look at Missouri. Missouri is at 43.8% this week. Last week was 41.3%, and that's up 2.4%, and testing's up as well. 48 tests versus 46. This is a legitimate rise, and your positivity is higher than it needs to be. And take a look at this. Arkansas. This is not good either. 38.5% positivity this week. Prior week was 27.3%. And that is 11.2% higher. Testing is also up. 26 tests versus 11. This is a big rise, which is not good to see. Louisiana this week is at 36.4% positivity. The prior week was 31.6%. That's a difference of up 4.8%. Total testing is 33 versus 19. Yes, this is a legitimate rise. Moving over to Mississippi, 28% positivity this week. Prior week was 47.8%. Difference of down. This is good. 19.8%. Total tests, 25 versus 23. So testing slightly up, and the positivity has dropped. That is good to see. Alabama. This is not good. Wow, this is really bad. 43.2% positivity this week. The prior week was 32.1%. That's a difference of up 11.1%. Total test, 95, and the prior week was 53. So it's great to see testing up, but despite that, and this is for Alabama, this is a decent sized testing increase, they still had a pretty big positivity increase. Taking a look at Florida. Florida this week actually saw the positivity drop. 45.9% this week, 48.2% last week. That's down 2.3%. And testing was up a good amount, 904 versus 795. So that is good to see Florida dropping. It's one of the bigger states. Georgia. Georgia is also dropping. 36.4% this week. Prior week was 44%. Difference of down 7.7%. Total test, 492. The prior week was 361. That's a big increase in testing. Take a look at South Carolina. 128 tests this week, 77 last week. What does that equal out to? Not so good. It's good to see testing up. The positivity also continued to go up. 42.2% this week. Prior week was 39%. That's a difference of up 3.2%. And now let's take a look at North Carolina. North Carolina, 46.9% positivity, 40.3% the prior week, difference of up 6.6%. 192 tests versus 159, that's a legitimate rise. Tennessee, 34.9% positivity this week, 40% last week, difference of down 5.1%. Testing was up, and your positivity is still too high. 129 tests versus 65. Then coming over here to Kentucky. 38.1% positivity this week, 46.4% last week. That's down 8.3%. Total test, 21 versus 28. So testing is down too, and your positivity is still higher than we would like to see it. We would like to see zero positivity, but you get the idea. Wow, this is a really bad one. Virginia, 51% positivity. Ooh, that's really high. 34.4% the prior week. Difference of 16.6% up. You're going straight up. Total test, 96. And the prior week was 90. Testing did go up slightly, but you need to see double, or you need to see at least triple the amount of testing. Maryland is 40% this week, 34.3% the prior week. Difference of up 5.7%. Total test, 25. Prior week was 35. That's a legitimate rise. Testing's down. Positivity's going up. Pennsylvania, my state, 28.2% positivity this week. The prior week was 27.3%. It's a difference of up 0.9%. Total test, 39 versus 33. This is a legitimate rise. New York State is 46.2% this week, 50% last week. Difference of down 3.8%. 78 tests versus 80. Testing's down by 2. Positivity still way too high. We would like to see way more testing in this. We already did New Jersey. I believe we did Connecticut as well. Let's do Massachusetts. Massachusetts is 32.4% this week. Last week was 38.2%. That's a difference of down 5.7%. Total tests, 37 versus 55. But we'll just show you New Jersey anyhow. It's 41.5% positivity. Connecticut is 40% positivity. And now we're coming over here to Ohio. Ohio this week is 38.1%. The prior week was 52.4%. Difference of down 14.3%. Testing stayed the same, 42 versus 42. And this is a legitimate drop. Again, though, your positivity is still higher than it should be. Indiana this week, the positivity is 36.9%, 47.7% last week, down 10.8%, 65 tests versus 44. Still a high positivity, but you know what? Your testing did go up. That's a good thing. All right, Illinois, this is a big one. And wow, how about that? The testing is actually equivalent to last week's testing. 42.7% positivity, still over 40%. That's pretty high. 45.1% positivity last week. 2.3% down, 213 tests versus 213. The overall trajectory on this chart for this one, I will show you, it is upward, so that is not good to see. How about Wisconsin? 38.7% this week, 40.4% last week, down 1.7%. Testing is up, 62 versus 47. And finally, we come to Michigan, because the states that we did not do in New England, you can't. They didn't have any update this week. Michigan, 40% positivity. Prior week was 36%. That's a difference of 4% up, and testing is down. This is a legitimate rise. 40 versus 50. I'm not going to say it's because of testing. I mean, we know things are rising in Michigan at this time. Speaking of that, let's take a look at wastewater. The biggest drop, though, believe it or not, is in the Great Lakes region, and then in the southeast. The west is still rising slightly. The northeast has kind of tried to level off. We'll have to see where we're headed. School's about to start up in the northeast. School's about to start up in many different places. We're not going to do the wastewater scan today because we do have other data to get to, and we just went through all that Walgreens data. And speaking of other data to get to, there is this, BNO News. More than 15,000 Americans were hospitalized with COVID-19 last week, an increase of 19% from the week before, and we can see that on the CDC page. And actually, the CDC page is saying it's 20.4% increase, which, hey, that's not good. Hospital admissions past week, 15,067. We'll get this map to update either late on Thursday, or we'll get it to you. More likely, we'll probably show it to you on Friday. Sometimes it comes in. Doesn't come in until 7 o'clock sometimes, and I'm not waiting until 7 o'clock at night to do the pandemic update because we'll have everything out already. Nothing in pandemic history today. EG.5 leads the way for variants at 20.6%. Then FL 1.5.1 is at 13.3%. I do believe this week we get an update for this, don't we? Yes, today's the 29th, 19th was the last one, so Friday we'll get the next update on this. And given we're going into a holiday weekend, they will probably spit this out first thing Friday morning. Probably no later than 10 a.m. or something like that. Because usually on holiday weekends, they're quicker to get that out there. Alrighty, we want to take a look now at New Jersey. Remember, we thought that number from New Jersey, hospitalizations, yesterday was wrong and too low? Well, turns out that's the case. Take a look here. 362 people in the hospital now. That's what? Nearly about 75, somewhere between 75 to 100 more than we saw reported yesterday, because remember, they had a low number, and look, there's yesterday. The actual number for yesterday was 331. They updated the data. 69 out of 70 hospitals reporting, 11 people on a ventilator, 44 people now in the ICU. That's not good. And taking a look at discharges, 36 people were discharged in the last 24 hours. Philadelphia Fire Department. This is where they tweet the latest, numbers, the call volume for yesterday. And the number that we are concerned about is not fire incidents, but 758 EMS incidents. That is below 800, which is a good thing to see. Let's do a live look in at the suburbs. You can see here right now, not too bad in Montgomery County. Prior to me starting this, Chester County was going insane, and okay, there's still a lot of calls here, but earlier this was even higher than this, and I'm seeing one thing that's showing up many of times. Respiratory difficulty, sick person, sick person, sick person, Sick person. A lot of people sick. That's not good. Earlier, this was near 20 calls. Just about, what is it? We'll say about a little over 25 minutes ago. All right, real quickly, we do want to take a look at Maryland. Then we'll take a look at New York State. Then the international update. And that's it for today's update. Maryland, not so bad in this region, but follow along with me here. Let's go to, where is it? Region 3. Region 3, yeah, look at this. These are hospital diversions. There's a color code. Go to my website. I do have the link to this. There is a section, a thread on my website that has all the links. I'll have the link to the thread down below that has all the links to these different pieces of data we use in our update. And included in that should be this. I'll make sure it's there. And you can actually show alert descriptions here. This tells you what everything means. Yellow and red, it's not bad. Any hospital that has a alert is bad. Orange is really bad. That's actually a reroute and saying, nope, we don't want any ambulances right now. And then we continue to Region V, and yes, there's a few yellow and red ones here as well. Not as concerning as the other region, but this means the hospitals are busy right now. So that is not good to see. All right, New York State. The positivity rate in New York State is 15.5%. 7-day average is 14.7%. They added 1,116 new cases. And drum roll, please. New York State starts the new week for the hospitalization data. And here's what it is. You see that number? Here we go again. Here's what it is. It is higher. It's significantly higher. So they ended last week at 1,050 hospitalizations. This week they have 1,163 to start the week. ICUs are at 111. And that's not bad because that number's actually down a little bit. But what is bad, once again, the hospitalizations in New York State are up. Now take a look at admissions. You can see here, admissions in New York State, they do continue to rise at this time. As you can see, let's zoom this in a little bit closer, and you can see here that they had 539 hospital admissions. New York City is also seeing an increase in the number of admissions overall. But as you can see here, taking a look at today compared to last week on Tuesday, actually look at that. It only increased by 1, so it slowed down a little bit. Maybe that's a good thing. Maybe it's New York City is going to peak soon. Probably too soon to call it, but we'll have to see. Maybe that is a good thing. Hospitalizations in New York City are at 524. 59 people are in the ICU, and that is a rise for ICUs in New York City. We also do want to take a look at the capital region if we can, and wow, look at this. Capital region hospitalizations last week ended at 49 with 1 people in the ICU, 1 person in the ICU, and this week it's 59 people in hospital and 3 people in the ICU, so that did go up. Alrighty, now taking a look at the international update. Let's refresh this. That way we have the most up-to-date numbers. South Korea, cases are down 9%, deaths are down 4%. United States, it is saying down 59%. Do not go by that. That is actually wrong, and we're actually not down 59%. Now, this is interesting and concerning at the same time. Romania, 11,419% increase in cases. That's 6,220 versus 54. I don't know if they have a backlog. I don't know what the deal is there. And that requires some investigation. If anyone knows what's going on there, please let me know down below. 8 deaths versus 3. That works out to a 167% increase in deaths. Russia, a 15% increase in cases. Deaths are down 17%. We'll just do a couple more here. Israel, cases now up 16%. Mako, cases up 49%. Chile, cases are up 21%. Hong Kong, cases up 10%. No deaths reported in any of these areas except for Israel, where there was 5 deaths reported. And then we come down here to India. Cases are now up 5%, and deaths are down 25%, 3 versus 4. Alrighty, folks, that does it for the Tuesday edition of the Pandemic Update. I know it was a long update today. We had to get through those Walgreens numbers. It's important that we do that. We'll have another update again tomorrow with some more data. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs a refresher or reminder that the pandemic's still going on, maybe they're going back to school, maybe they want to see some COVID numbers, by all means, share this with them. And if you do know anyone going back to school, maybe you have a child going back to school, please make sure they mask up when they go back to school. It's an effective tool. I know it's not going to be as effective when we're walking into schools where, you're the lone masker and there's not as many people masking. But you know what? It's still better than not masking at all. And trust me, you will still find yourself in some protection versus those who decide not to mask. Alrighty, guys, I will see you again tomorrow. Until I see you again next time, stay safe, everyone, and thanks for watching.